I'm Angie Karamchandani, and I am 33, and I'm from Princeton, New Jersey. Right now, I'm home with 4 of my kids, so that's my full-time job. When I went to my plastic surgeon, she gave me a couple of different options. One of them was a deep flap, and then they would put an implant underneath, or I could get breast implants put in instead, so I went with that option. We ended up feeling that the Natrelle was the best choice for me and for my lifestyle, and I wanted to remain active and I wanted to still feel like myself, so that's why we kind of decided that Natrelle would fit me well. My plastic surgeon talked to me about fat grafting, and after discussing what I wanted and what I wanted it to look like, she suggested that we take some fat from my thighs just to add some fullness. I really self-advocate because I want other women who are like me to speak up, to ask questions, to just make sure you speak your mind, because no one should make your decisions for you. You have to make your own decision, and you have to fight for your own life. No one's gonna fight for you if you don't fight for yourself. I would say find a surgeon that you really trust, and you get overwhelmed with so many options and so many choices and so many people giving you advice, and your head kind of fills up with so many things. And if you find a doctor that you trust and you know that they're going to give you the very best advice, at least you have that in your pocket. And I really trusted my surgeon to kind of give me her best advice and what she thought would fit my lifestyle, and explain the kind of life you want, explain the things you do so that they can best guide you. My reason for sharing my story is because I want other South Asian women who look online for an answer, or look online to decide whether they should get a mastectomy or not, or whether they should go for the mammogram that year, to look online and be able to find someone that they connect with or they resonate with, or someone who just looks like them. And if anything, if I just do this so that my daughter can look online and see pictures of her mom and see that her mom spoke up and her mom did these things, then at least she has answers. It's hard now, but it's not always gonna be hard, and it gets better. And I think if you just focus on the fact that things will get better and you have that mindset, it will, and you just have to keep on going. I really love my implants. I feel that they work well for me, and there's so many things that get taken away from you that you want something that's gonna make you feel a little bit more like yourself.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.